You are listening to Supplement Source, the official podcast of the Council for Responsible Nutrition. And now, your host, Jeff Ventura.
Hello, and thank you for joining. I'm Jeff Ventura, your host here at the Council for Responsible Nutrition. And I am so excited to be joined today by two of our members from Verb Biotics, Diane Alexander, who's the Director of Sales, and Camille Delebecque, who's the Head of Biotechnology. Exciting conversation today. We're going to talk a little bit about how Verb is leveraging innovative technologies to help underserved populations. Diane, Camille, welcome.
Thank you.
Thanks so much.
We are so excited to talk with you guys today and to really cover the ground about what you folks are up to these days. I think one of the things that we want to discuss right out of the gate is talking about how Verb is filling some critical gaps in women's health by focusing on under-researched areas like stress management, I know you're doing, mood regulation, sleep quality. Let's just kick it off with maybe a chat about trends or challenges that are currently shaping biotech or the microbiome industry. What's going on with Verb Biotics in terms of positioning itself to respond to some of these challenges?
Yeah, it's a fantastic question, Jeff. But first, thanks for having us here. We're super excited to have this conversation with you today. Yeah, so Verb, was started in 2021 in direct response to a few specific challenges and opportunities that we were seeing in the industry. First of all, we're extremely lucky to have a team of industry veterans, and many of them, were brand owners themselves, kind of like grappling with the lack of differentiated and truly efficacious solutions out there, or involved with major probiotic suppliers that were just, maybe too slow or too big to really innovate and make a real difference. So the other trend and kind of like the major opportunity that we were seeing that was maybe making wave outside of the biotech industry at the time was specific convergence with like three new types of tools that were becoming available. So new biotech tools, genomics, all this high-throughput screening, lab automation, and AI and ML. And that really kind of like opened the doors for people, for Verb, to do things differently and a lot more intentionally. So, instead of like stumbling into a microbe and slapping clinicals on it and see what sticks, them capturing, of course, but we take the model upside down. So we start with identifying a health area of interest and, an underserved population we'd like to address. And then we go into finding those metabolites that may positively affect that specific health areas. And then only then, we go into finding microbes that can, or more widely, biotics. We have also launched a postbiotic, for example. But so biotic solutions that can deliver that metabolite, at the right time, at the right place, in the right quantity. So it was really kind of for us an opportunity to get away from this race to the bottom that we're seeing, that is, the more CFU, the better. And these new tools really kind of like enabled us to do that intentional way. And, at the end of the day, at Verb, we really see specific metabolites or mechanism of actions as kind of like the real heroes here for efficacy.
That's great. And, when we're talking about this, I think a natural segue is to talk about maybe how Verb is, driving growth in the industry. Give me a little bit about that.
Yeah, no, great question. And when we're talking to brands and looking at consumer research, it really seems like the biggest questions consumers are asking is, what do I take? They're in the store, they're on Amazon, there's hundreds of biotic options.
It can be very confusing.
It's super confusing for consumers, but consumers are getting more educated, certainly on what their health needs are, how biotics could potentially help them. And I think what we're really doing at Verb is we're taking a function specific approach, like Camille said. So having a function specific approach, we really mean, focusing on certain metabolites and compounds versus, hey, we have X number of strains or next X number of CFUs. So we think this function first approach is going to make more sense for consumers and give them a better reason to believe. So one example is our Lactobacillus plantarum 815, which produces GABA, which is the major inhibitory neurotransmitter in the CMS. So we know this, probiotic produces GABA. We know what GABA does. There's a wide array of published literature supporting, benefits of GABA. So by making this link, we think it's going to be easier for consumers to understand the benefit of the probiotic versus, hey, I'm buying 10 billion CFU. So that's really what we're trying to do at Verb, to have a more, metabolite-driven approach. And, the other component of that is, okay, it's great, this strain is producing GABA, but then proving out through clinical studies that directly provides a health benefit and a better experience for the consumer. They're feeling a difference. They're feeling better.
I mean, it really is quality, not just quantity, to put it simply, right?
Absolutely.
100%.
I think a natural next piece of this discussion is to really talk about this innovative approach that Verb is known for. Talk a little bit about the flagship technologies or the products and how, and you've done this a little bit in this discussion, but how do they differentiate, say, from your competitors?
Yeah, maybe, I'll actually bounce back on the example of LP815 and take that strain and the development of that strain to make it more tangible, right? So first thing is GABA, super interesting metabolite, as Diane said, but it has a really short half-life. And so it needs to be delivered in small dose continuously versus kind of like a bolus dose. And that's why we saw the opportunity to deliver it here as a probiotic. So then the next question, is how do you go in finding a probiotic strain that can robustly produce clinically significant amount of GABA, and what tools can you leverage? So for us, it was kind of like a carefully orchestrated dance between in silico screening and in vitro screening to identify that strain. And so on the in silico side, we started with in silico. It was, identifying which pathways, which enzymes and genes may be responsible for GABA production. And then kind of like that enabled us to narrow down the top of the funnel in our screening campaign. Then, once that was done, we went into in vitro screening, leveraging, high throughput screening and, of the lab automation tools that we have at our disposition. And we actually still onboarded, I think it was over 250 million variants into that screen. So yeah, still looking like really, really wide, right? And, so it was high throughput screening using actually like gut-like condition. So the idea was to, as early as possible, kind of like bridge the gap and the valley of death that we see between kind of like the bench and real human gut-like conditions,
Mm-hmm.
And then
which can be very different, I'm sure.
100%. So then, once we had a few hits, like a few strains we thought were potentially interesting, we went back to in silico screening. So it was AI, ML models to kind of like confirm that those strains could play well with the rest of the microbiome. So it's like multi-species modeling to make sure that you still produce high quantity of GABA in these difficult and varied environments. And also kind of like starting to understand the interaction between that hero strain, the LP815, and the human epithelium, and seeing if the GABA would actually be uptaken by the host, by us. It was really kind of like another step of in silico screening to confirm that the strain had a high chance to succeed in clinical trials. And then, to Diane's point, going to state-of-the-art clinical trials, we don't use animal models at Verb. We think humans are the best models. And so, getting into gold standard clinical trial to show real life efficacy. So it's really kind of like the combination and this kind of like full display of tools that enabled us to narrow down on LP815.
And let's talk a little bit about, this sounds like a breakthrough in and of itself, but I mean, what are we talking about in terms of like the biggest breakthrough or challenge that you guys have faced in developing your technology, and how did you overcome it? I mean, that sounds like one example of that. I mean, are there others?
I think it really, it comes down to, because we have, this kind of metabolite driven approach. It's okay, we find a health benefit or, a need in the market among consumers. And then, we see obviously in consumer research that Verb's conducted. So we actually conducted our second annual consumer survey last year of over 2,000 consumers who were open to taking vitamins and dietary supplements. And through that work, we found out there was an underserved need by women to address stress, tension, sleep, across different life stages, specifically during their menstrual cycle and the menopause transition, because interestingly, GABA actually varies with some of these hormone levels over, a monthly cycle, or even, in different transitional, hormone transitional states across the lifespan. And so since we're seeing that real need, then it's, the question becomes, okay, how do we solve for that? How do we address that need with a biotic? So with a live organism, we identify, okay, there's a specific molecule we're interested in. How can we get a bacteria to produce that specific molecule at efficacious levels? And I think, Camille really talked to the amount of work and technology it takes to actually find that bacteria amongst the millions of potential variants. And then once, okay, you find this bacteria, but is it going to survive in the gut? Is it going to produce this, in the human body amongst, the trillions of other bacteria are there. So that's really where the rubber meets the road.
Yeah. Wow. Regarding your upcoming women's health solution, tell me about how this is different than other biotics out there for women.
Yeah. So when you're on Amazon or at the retailer and you're looking at probiotics that are marketed to women, at least what I'm seeing is many of these are really addressing, vaginal health or urinary tract health. There's not a lot outside of that. So we mentioned in the previous conversation that so many women are struggling with stress, low mood, low sleep quality, whether that's struggling getting to sleep or struggling to stay asleep.
Men too.
Right. And whether or not, they're open about that, is another question. But yeah, absolutely. Yeah. This is a universal problem. And we found that as hormones lower, whether that's at a certain time of the month or a certain, life stage, GABA tends to lower as well. So further impacting the low mood, the stress, the irregular sleep cycles. So these fluctuations, are very, very typical. And so that's really where we think we're going to have a real impact with our LP815 to help moderate these mood, stress, sleep changes that occur over time. We're really excited about the data that we have, showing that it has a really positive and statistically significant impact on stress and mood, not just in women, but, in men as well, because our study was both men and women. And we have a second study underway, really digging into a much more deep level. So we're excited about what's to come in the next few months.
Well, we're excited that you came on today and actually shared some of the amazing things that Verb is working on. We always love hearing from our members and really getting down in the weeds, or in this case, down in the gut, and learning more about some of the innovation that is coming down the pipeline. So thank you so much to Diane, Alexandra, and to Camille Delebecque from Verb Biotics for joining us today. Until next time.
Thank you, Jeff.
Thank you.